for fingerprint criminal background checks. I'm Nigel Lang. I'm the Deputy Inspector General at the Department of Community Health. I would just like to advise you that this webinar will run for approximately 60 minutes. The presentation will be approximately 30 minutes, with the remaining time of the hour allocated for questions and answers. If you do have a question, you can only type it in the feature of WebEx that you should find located towards the bottom right of your screen. Hopefully most of your questions will be answered during the presentation, but feel free if you have a question to type it at any time during the presentation, and we'll hopefully be able to get to it at the conclusion of the panelists' presentations. So with that, I would like to introduce the panel. First of all, we have Sonia Allen-Smith, who is the Inspector General here at the Department of Community Health. Denise Matthews, who is the Background Investigations Unit Manager. We have Sakina Johnson, who is the Backgrounds Investigations Unit Supervisor. Also with us, we have Melanie Simon, who is the Executive Director of the Healthcare Facility Regulation Division here at the Department of Community Health. Also with us, we have Marina Fox from the Georgia Bureau of Investigation, specifically the Georgia Crime Information Center. And we have finally Brad Morris, who's with us from Innovative Architects. I want to advise you that the meeting is recorded, and that includes any questions that you may type into the question and answer feature. A replay of this webinar will be available after the conclusion of this meeting on our website. So with that, I'll first hand it over to Denise Matthews to get us started. Denise?
Good afternoon. My name is Denise Matthews, and I wanted to give you a just an overview of the Background Investigations Unit. Sakina Johnson will be giving that overview. Sakina, can you advance the slide, please? And our agenda today will be the Background Investigations Unit overview, Melanie Simon, the RATBAC overview, and the G-Checks employment verification overview, and our points of contact, of course, and we'll answer some questions afterwards. All right, Sakina, you can take it from there.
Yes, hi, good afternoon, everyone. I want to start off with the Background Investigations Unit overview, and the Office of Inspector General Background Investigations Unit performs state and federal criminal history background investigations on behalf of the department, including the Office of Healthcare Facility Regulation and the Office of Human Resources. We're located within the Office of Inspector General, and we receive and process the criminal justice information from the FBI and GCIC for the purpose of providing employment, suitability, and or licensing determinations. Denise, back to you.
Okay, thank you, Sakina. What is RATBAC? This is what we're here for today. RATBAC basically stands for Record of Arrest and Prosecution Background. The RATBAC program is the retention of applicant or employee fingerprints for an ongoing monitoring or continuous evaluation of the criminal history status, so as long as the individual remains employed or licensed by the department or the provider. So what this means is if an employee is no longer your employee, if an applicant or employee is no longer associated with your facility or your business, then we no longer would have the right to retain those fingerprints. So we would have to separate that individual from RATBAC. A RATBAC program will inform a government agency, DCH, when an individual who has undergone a fingerprint-based background check and whose civil background checks are retained by a criminal history repository, which would be the GBI in our case. After the check, if that applicant or employee is arrested or there's any other criminal justice activity, then we will receive that information. So therefore, a state wrap back program offers ongoing monitoring of direct access employees working with the vulnerable populations. Next. Okay, I want to give you an overview of what SB 336 was. Basically, SB 336, and there was a HB 91. The governor signed HB 91 into law, which allows GBI and FBI to retain the applicant's fingerprints. This was signed into law in 2019, and the Wrap Back legislation was also signed into law on May the 7th of 2018. Next. Once the Wrap Back is implemented, certain Georgia state agencies that have oversight of vulnerable populations, such as the disabled, children, and/or the elderly, meaning DCH, are authorized through legislation to voluntarily participate in the Wrap Back program. DCH is the first department in Georgia to go live with Wrap Back. When will the Wrap Back program be deployed? I'm happy to say that the Wrap Back program will go live and be deployed on August the 30th of 2021. So when your applicant is fingerprinted on August the 30th, 2021, then we will retain those fingerprints. So that applicant will be automatically enrolled into the Wrap Back program and be monitored. What does continuous monitoring mean? It means that the individual civil fingerprints will be retained and monitored until the termination of employment or the end of the license. Meaning, if that facility or provider no longer holds a license under the Healthcare Facility Regulation Division, then we would not have the legal right to retain the fingerprints of that facility's owner or employees. Or if that employee is no longer employed, then we would not have the legal right to retain those employees' fingerprints. But if we're monitoring those fingerprints, if the employee is arrested, or if there's any type of, like say the employee has an open arrest and the employee goes to trial and the employee is determined to be guilty, then DCH will receive information regarding that conviction. And then if an adverse determination is made, then we would notify the facility regarding that adverse decision. So what is the provider's responsibilities? Well, the provider responsibility, we ask that you ensure that your G-Check employee roster is updated and validated. Properly separate the employees in the G-Checks roster if the employee is terminated, not hired, or if the employee resigns. It doesn't matter if there will be a one-day separation. So if that employee leaves on Friday and starts with another employee on another employer on Monday, then that employee has to be separated within the G-Check system, because we would not have the right to retain that employee's fingerprint. That employee would need to get new fingerprints completed at the new facility or provider. And also ensure that the applicant or employee acknowledges the FBI, GBI privacy rights and caregivers portal disclosure. So what that means is currently there's a consent form that everyone all the facilities and providers upload into the G-Check system at the time of the G-Check's fingerprint registration. Well, we're automating that. So we have to make sure that the employee completes that form or completes the process through the automation. So once the employee is registered, there's going to be an email that is emailed to the employee that basically will allow the employee to certify, validate that they have read the privacy policy. And once that is completed by the employee, it will automatically update the G-Check system. and the provider will be able to continue with the registration. Next. And to explain this process as far as how to validate your employees, Brad Morris, when Improving Atlanta, is going to explain how that process goes.
Thank you, Denise. Okay, so this first slide is about the home screen at a glance page. And there's 2 line items to pay attention to here: the employment verification needed within 30 days and the employment verification past due. These numbers over to the right indicate the number of employees that you have in each of those statuses. So when you click that number, it brings you to the employment verification page. Here, if you come to this page a different way, you can hover over the your employees and get to the where you would go to roster page, and you can go to employment verification. This first purple icon here is to show you that we default the page to filter within the last 30 days, or who's due. Actually, that's in the next 30 days. So you can see who's coming up from verification. The first row here is an example of somebody whose employment was last verified in 2020. And this was a test case, so this was quite a while ago. And the verification was needed by September 2nd of 2021. What you would do if that person's still employed at your facility, you would check the checkbox there. That will light up the Verify Selected button, and you can push that button to verify the person. So this is an example of the Verify Selected button lit up here, where you can click it because you've checked one. Just to point out, if your search criteria within the next 90 days has more than one person, you can select multiple and click Verify Selected one time, and it will verify everyone that you have selected. Next slide, please. Yeah. So you can see the dates have been updated on our test case here. The employment last verified date has moved to August 10th. That's when we built this slide. And the verification needed by has become September 10th, 30 days from now, as this verification process would need to be done every 30 days. Okay, so Denise, back to you.
Okay, thank you. Okay, I'd like to provide our points of contact. You can contact the Background Investigations Unit at the following email address and telephone number above. You can contact me at dmatthews@dch.ga.gov or Sakina Johnson at sakina.johnson@dch.ga.gov. And I think we're ready to move to the Q&A section of our presentation. Oh, hold on. Melanie Simon, I so apologize.
No problem at all,
Melanie's here to
Denise.
provide some updates. I apologize.
No problem at all. Well, good afternoon, everyone. I'm Melanie Simon. I'm the Executive Director of Healthcare Facility Regulation. Want to thank you for joining today's call. We're talking about the Long-Term Care Background Check Program. And as I'm sure all of you know, that applies to 8 types of licensed facilities. So it's nursing homes, intermediate care facilities, home health agencies, hospices, adult daycare, personal care homes, assisted living communities, and private home care providers. I just wanted to give you a few regulatory updates. Wanted to express appreciation first to the Office of the Inspector General and Sonia, Nigel, Denise, Sakina, and the entire team for all of their work on the implementation of RATBAC, and also the Georgia Bureau of Investigation for that work as well as the contractor. It's very positive that we're at this point, and we really appreciate all of their support of our regulatory programs. So a few regulatory items. Right now, we're in the phase of the implementation of this long-term care background check program, where fingerprint checks are required for new hires. So new owners, new directors and administrators, and new direct access employees. We are aware with the pandemic and the situation continuing to evolve, that there are still some fingerprint sites that may be closed. And what we ask you to do from a survey standpoint is please document any access issues that you have, so that we can take that into account in the survey process. But right now, any new hires do require a criminal fingerprint background check. Effective January 1st of 2022, that is the deadline for you to get existing employees, existing administrators, and owners a fingerprint check. So you have until January 1st of 2022. The legislation, you may recall, said 2021, and we extended it a year due to the public health emergency. But that deadline is now January 1st of 2022. You will want to wait until August 30th when RAPBAC goes into effect to start that process so that the fingerprints can be retained. And that way you will be informed if there is any subsequent arrest or conviction for that employee. But between August 30th and January 1st of 2022, you need to go ahead and send all of your existing employees, administrators, directors, and any existing owners to get a fingerprint background check. And these would be those that existed that were in place before October 1st of 2019. That's when the legislation went into effect and we got new exclusionary crimes. So one of the main questions that we're getting now with the implementation back is what happens to those that had a fingerprint check between October 1st of 2019 to August 29th of 2021, right? So those fingerprints have not been retained. There was no RAPBAC mechanism, legal authority for the department to retain those fingerprints. So they don't fall under RAPBAC. Anyone that gets a check August 30th or after will automatically fall under RAPBAC. So if, for example, you hired a new employee in 2020 and you had a fingerprint check done at that time, they're not going to be under RAPBAC. We did not retain their fingerprints. However, they are not required to get a recheck a year later. There's no requirement for them to get an additional fingerprint check unless they change employment. So as long as they remain employed at your facility, they do not need a recheck. Even if they stay with you 5-10 years, at no point will it trigger a requirement for a recheck unless they change employment. You would have the option, if you want them to fall under RAPBAC, you would have the option to repeat the check if you wanted to, to pay the $50 or whatever it is and do that, but it's not a requirement under the law. The only thing that will trigger the recheck is if they go to work at a different facility, or in the event we receive a complaint or an allegation of some kind, in which case we can force a background check under the state rules. So if we get an allegation of abuse or something of that nature, and it's been more than a year since that fingerprint check, then we can require them to have an additional fingerprint check. But in the absence of employment, there isn't any requirement for those folks that fall under that, what I'll call phase 1 period, to get a recheck. I think that's all of the updates that I have. And so I will turn it back over to Denise. And again, thank you for participating in the call today.
Okay, thank you, Melanie. I would like to turn it over to Marina Fox with GCIC to see if she has anything that she would like to share with you.
Hello, Denise. Hello, everyone. I don't have anything else to add unless there are any questions. I think Melanie explained it pretty well regarding why the individuals will have to be re-fingerprinted in order to be enrolled in RAPBAC, since we're just now retaining the prints for your agency. I'm happy to answer any questions that you all have, but I don't have anything else to add right now.
Okay, thank you, Marina. All right, I think we're ready to move on to the question and answer segment. So,
Okay.
Sakina?
Okay, yes. First question will be, will the presentation be recorded and available for participants after the call, and where will it be located?
Yes, it will. The questions and an FAQ and the presentation will be available on our GChex website. And I will provide that link. I think I can provide it on the chat. So I can provide the link, or you can email me and I'll send you the link at dmatthews@dch.ga.gov. But most of my providers know the link. dmatthews, know my email address, dmatthews@dch.ga.gov.
Okay, thank you. Next question. For those employees fingerprinted through GChex prior to August 30th, will they be automatically entered into the program?
Those providers that are fingerprinted after August the 30th, those employees will be added and their fingerprints will be captured and retained into RATBAC.
Okay,
This is Melanie. So anyone prior to that, we would not have their fingerprints. So if they were fingerprinted prior to August 30th, they will not be part of RATBAC. There isn't any way to get their fingerprints. They've already been discarded.
That's correct.
okay, thank you. Next question. Some aides work for more than one agency. Is that a problem?
Okay, if an applicant works with provider one, then their fingerprints will be retained. If the applicant is background checked at the second provider, at the second agency, that applicant's background check will be retained also. Marina, did you have anything you want to input with that?
No, it's basically the applicants are going to be enrolled in RATBAC under the DCH ORI, and attached with that, there will be an area for one of the GAP numbers for one of the agencies. So if they're working at multiple agencies and both agencies want the RATBAC subscription, then it's likely that an individual would have to be fingerprinted twice.
Okay, thank you. Next question. So an employee has to get new fingerprints done and pay every time they apply to a new agency? And is this so even if they have already been through the fingerprinting process?
If the applicant has separated from their previous employer, then we no longer have the authority to retain those fingerprints. So if the new employer wants, the new employer would need to fingerprint the employee to have those fingerprints retained at that time. So if the employee leaves an employer, we cannot retain those fingerprints until the applicant is newly employed at with another provider.
Okay, thank you. Next question is, did I understand that the applicant has to be emailed by GChex and agree to RATBAC before we can register them for fingerprints and then fingerprint them?
Well, what happens is it's called consent. It's just like when you go to the doctor's office and you sign that Privacy Act stating that you know what the doctor's going to do with your results, who they can talk to. It's the same concept. Right now, it is required for the employee or the applicant to sign and validate that they have seen they have read and understand the Privacy Act, the GBI and FBI Privacy Act. Within that language is language that indicates that your fingerprints may be retained. So yes, the applicant has to sign that. We're making it a little easier. We are going that information will be emailed automatically to the applicant, and then the applicant has to just check the box and attest to the fact that they have read that and understand it, and then that information will automatically be transmitted into the GChex system. Whereas before, each facility had to physically get a signature and upload the information into the G-Check system. So we're kind of simplifying and streamlining that process to make it easier for the providers.
Okay, thank you. Next question. How will we notify you when an employee is terminated? Is it through this program?
Actually, Brad went over that. Brad, can you respond, please? Thank you.
Sure, I think this might be a little different. I went over verification. This is the employment management piece. There's actually two places. You can do it on the person summary page employment tab, but it might be easier if you're managing with your roster. You hover over employees in the navigation and you get a roster link. And then from there, you have the buttons you need to separate employment or change from provisional to permanent, things like that, depending on your settings. So I would recommend you go to employees roster page, and you can also do it on the person summary employment tab. Thank you.
Thank you, Brad.
Okay, next question. Will there be any funding to help providers?
Well, the G-Check system is already available to providers, so I'm not aware of any funding that will be available. The G-Check system is already available and providers are required to use it in order to obtain a background check. Melanie, did you have anything to add to that?
That's correct. There isn't any funding or reimbursement for the cost of the fingerprinting itself that I'm aware of at this time. That would probably be more of a Medicaid question for enrolled Medicaid providers, but no, I'm not aware of any funding or reimbursement for the cost of the fingerprinting.
Okay, thank you. Next question. For everyone who was hired before this date, do we have to have those employees fingerprinted or just the new ones?
So for the existing employees, that would be individuals hired prior to October 1st of 2019. That's when the exclusionary crimes changed. So even if those individuals were fingerprinted, let's say they were fingerprinted in 2017 or 2018 or any time prior to October 1st of 2019, those existing employees have to receive a fingerprint check before January 1st of 2022.
Thank you.
Thank you. Okay, next question. How do these changes apply to volunteers?
So the volunteers do require a fingerprint background check if they're direct access employees. It is to include volunteers and contractors if they have routine contact with the residents or if they have access to the residents' financial information or personal property. So it's going to depend on the type of volunteer and whether or not they have that access. For example, if you have someone to come and play the piano in the, in the dining hall, right, for large group gatherings, and it's just an occasional thing, that would not be routine contact. That would just be intermittent. If you have a pastor that comes and speaks, versus if you have a pastor that goes and meets with individual residents, every Thursday and is one-on-one with residents, then that's going to be considered routine contact. So it just depends on the type of access that the volunteer has as to whether or not the requirement is triggered.
Okay, thank you. Okay, next question. Is fingerprinting required every year for each employee? And if so, when?
It is not an annual requirement. It is required at the time of hiring. So it's for owners, it's required when you apply for your license or if you have a change of ownership. For directors and administrators, it's when they're appointed to the position. And for direct access employees, it's at the time of employment. If you If you have an employment separation, then that's when it triggers a requirement for someone that was previously fingerprinted, as we mentioned earlier.
Okay, thank you. Next question, this is kind of a combination of two questions. It says, what about individuals who had fingerprints checks done before 2019? Do we need to redo their checks?
Yes, because the exclusionary crimes changed when Senate Bill 406 became effective on October 1st of 2019. So if they got a check before that time, that check did not include all of the exclusionary crimes. The standards changed. And so you have until January 1st of 2022 to get that individual a new fingerprint check.
Okay. The next question is about what about direct care staff? Are they required to be rechecked?
Only if they change employment.
Next question, which facilities does this affect?
So it's long-term care facilities, and that is defined in Georgia as 8 facility types: nursing homes, intermediate care facilities, home health, hospice, adult daycare, personal care homes, assisted living communities, and private home care.
Okay, thank you. Next question, Southwest Georgia needs additional fingerprint locations and mobile services due to the rural location. Many potential employees and current employees do not have transportation to get to the location in Albany, Georgia. And then someone stated they requested an application to become a fingerprint location, and they hadn't received any additional, no additional providers. They received an email saying that no additional providers were needed. And they wanted to check on that to see if that was the case.
Marina, can you assist with that question?
So if you'll do me a favor, if I can provide my contact information, if you'll send me your information, I will definitely reach out to our vendor and find out why you received that message. Because if we don't have fingerprint sites down there and you're willing to be a fingerprint site, we will go ahead and get that set up. So Denise, I'm not sure what's the best way to provide my contact information.
I guess maybe if we can do it in the chat. I don't see the chat line available on my screen, but maybe we can just provide your email address on the chat.
Okay, I will try to do that then.
Okay, are you able to type into the chat? I wasn't able to, but
I don't know if I am able to.
Someone can respond directly to that question in the Q&A box. You can and just click send privately, and you'll send it right to who asked the question.
Okay, I'll try to do that. I've highlighted the question and I see where I can, okay, I'll figure that out how to do that, and I'll go ahead and send you my contact information.
thank you, Marina.
Okay, thank you. Next question. How does this work if we are using temporary employees from a staffing agency? They provide fingerprints on our behalf.
Okay, if the temporary staffing agency is obtaining a fingerprint, temporary staffing agencies are not included in the RAP Back legislation. So if you want that temporary employee to be monitored, then the facility or provider will need to conduct those fingerprints on that temporary employee.
Okay, thank you.
Well,
Next question. If an applicant is initially determined unsatisfactory, but then goes through the appeal process and the decision is reversed, what is the process of getting a satisfactory letter and the applicant hired through G-Checks?
okay, if the applicant has received an unsatisfactory determination and the applicant has completes a appeal and the judge overturns our decision, then because there is an amount of time between when the applicant was last fingerprinted, sometimes it's 3 months, 6 months, we will require that applicant to obtain a new fingerprint. Once that fingerprint has come through our system, then we'll do another review. If there's no new arrest or no new charges on that applicant's fingerprint since the last time the applicant was fingerprinted, then we will issue a satisfactory. There have been cases where an applicant may have received a satisfactory from a judge because the applicant had not went to trial yet. But in the process of that, the applicant goes to trial and is found guilty. And then we have a whole new ball game that starts. So we need that applicant to be re-fingerprinted so that we can ensure that there's no new arrests, no new convictions, no new information, dispositions, court disposition related that will be on that applicant's record.
Okay, thank you. Next question, does this apply to community living arrangements?
No, it
Melanie?
does not. It does not. Community living arrangements have to follow the fingerprint background check requirements set out by the Department of Behavioral Health and Developmental Disabilities. They don't fall under this long-term care background check program.
Thank you.
Okay. Next question. So we will need to update and verify the employment of our employees every 30 days. Is this correct?
Yes, this is correct.
Okay. Next question. I am an owner and just got fingerprinted a couple months ago. Do I have to redo them after August?
No, you do not need a recheck.
Okay. Okay, next question. There is a great turnover in personal support services. The cost will be too high. What do we do about this problem?
I recognize that this is a very challenging time for staffing in long-term care. I think we're seeing that every day with the pandemic, and I know that it's challenging, and unfortunately, I do not have a solution to that issue, but certainly we know it's a very challenging time for the long-term care community.
Okay, next question. Is there a fee for the background checks and how much?
Background check fee is $51.50 per fingerprint.
Okay. Next question, is a nurse practitioner exempt?
Yes, a nurse practitioner would fall under the nursing board and therefore would not require a fingerprint criminal background check. So any of the professionals that fall under a state licensing board, so that would include social workers, respiratory therapists, dietitians, nurse practitioners, registered nurses, LPNs, physicians, pharmacists, etc. They would not require a fingerprint criminal background check under this regulation.
Okay, thank you. Next question, do we need an additional login to RATBAC or does it tie into G-Checks?
You do not need an additional login. Basically, when you register that applicant in the G-Check system and then go over to the Gemalto system to pay for the fingerprints, and that applicant is printed, basically the applicant has their fingerprints captured, then that applicant will be retained into RATBAC. So there's no additional cost, no additional login.
Okay, thank you. Next question, how soon after an employee separates does the system need to be updated or like a deadline?
Marina?
So it really needs to be done immediately. Once you no longer have the authority to receive any type of criminal history record information for an individual, then you don't have the authority to have them enrolled in RATBAC. We are going to allow a little bit of a couple days grace period, but it really needs to be done immediately. So the moment that person leaves your employment, one of the first things that you need to do, along with terminating any other type of access that they have, is to go in and make sure that they are unenrolled from RATBAC.
Right. So once you guys terminate them in G-Checks, then we have another process that we have to go behind you in Gemalto's system and separate that employee. So when you separate the employee, that's going to trigger kind of a domino effect for us to jump in and do our separation. Thanks,
Okay,
Malia.
thank you. Thank you. Next question, do we need any documentation to give to our employees when getting the background check?
When they get the background check, you will just need to provide them with the registration receipt, the paid registration receipt to take to the LiveScan provider. They will need their picture ID, their legal ID. I just want to mention also, we find ourselves doing a lot of corrections with the names. Basically, the fingerprint provider, being the FBI, requires the name on the driver's license to match. So if that person is registered under Brad Jones and his real name is Bradley Jones, then the LiveScan provider is going to turn that applicant away because there's not an exact match. So if the registration receipt is different than what's on the driver's license, then they will be turned away. So please make sure that the names match, names and date of birth is exact on your registrations.
Okay, thank you. The next question is that they believe that one of our agency locations is still having access issues in the area. When you say we need to document those issues, how do you recommend that we document?
This is probably for me.
Yeah.
I think you just need to put that into the file. You just need to put that information that when they were hired, the location site that was closed, any attempts that were made to get them fingerprinted, whatever challenges you've experienced, it can just be a narrative. Just need to document the relevant dates and information and put it in the employee file so that when we go out to survey, we'll see that there were some extenuating circumstances related to the pandemic, and we can take that into account.
Thank you.
Thank you. Next question. Will we get an email notification when we need to verify employees, or just need to check in G-Checks regularly?
Okay, thank you for asking that question. Yes, we are in the process of working with Improving Atlanta, our vendor, to get those notifications turned back on. I know that in the beginning, when we first deployed the new background check requirement, October the 1st of 2019, those notifications were turned on. We did receive a lot of complaints because the notifications were going out pretty regularly, but we turned it off because we were waiting on RATBAC to be deployed. So those notifications will be turned back on. So we're working on that now.
Okay, thank you. Okay, these next questions I think may be related. First question is, even though the fingerprints have been disregarded, if they were taken prior to August 30th, 2021, they do not have to be fingerprinted again, correct?
Correct. So I'll try a little bit of a campy analogy. The law went into effect October the 1st of 2019. So picture that you had a background check for new employees starting at that date and that they got a hamburger, okay? effective August 30th, 2021, the hamburger now comes with cheese. The wrap back is the cheese. So if they already got a hamburger, they don't need to get another one. They're not going to be part of wrap back if they got it before August 30th of 2021, but they're still covered. So the existing employees that have the January deadline were people that were in place prior to October 1st of 2019. And those individuals have to get a fingerprint check before January 1st. And if you get it after August 30th, it'll be a cheeseburger because it'll come with wrap back automatically. I don't know if that's helpful or not, but if not, put it in the chat box again and we'll try to explain it differently. I know it's a lot of dates and it is very complex. So these are all great questions.
And I wanted to add one of the benefits of wrap-back. It really allows the providers to reassure the residents and beneficiaries and prospective residents and their families that they have an ongoing procedure to help enhance security. So I think it's just worth, if you're able to get those employees fingerprinted so that your residents can have an additional level of safety.
Okay, thank you. Okay, next question. If the applicant lives out of state and work remote, which state do you need to get fingerprinted in?
Well, if they're working remotely, they may not have a fingerprint requirement. I guess if they have access to financial information, they would, or if they're an owner. So in that case, I'll let Denise and the team tell you where they would need to go for the fingerprint check. I assume they would need to come over to Georgia and get it done here somewhere, right, Denise? Or
yes, there's a couple of processes. Okay, so if the applicant lives in Georgia, then the applicant can be registered in G-Checks, and then the applicant will find a Gemalto Talus location located in Georgia. If the applicant or employee lives outside of the state of Georgia, but provides, I guess they're working remotely for the facility and has the access to, like you say, those financials, then another option would be to use the old fingerprint card process. The applicant will still need to be registered through the G-Check system. However, when it comes time to pay, you would check the box which says paper fingerprint cards, and then you would also pay an additional $8 fee on top of the $51.50 cost, and then the applicant will get fingerprinted at a local police station or sheriff's office, get their fingerprints rolled on paper cards, old school, and then you would have to mail those fingerprint cards to California, and it would take 6 to 8 weeks for those fingerprint cards to be processed. So the benefit would be for the applicant to be fingerprinted in Georgia. But if there's no other way for that to happen, then there is the old snail mail way, which is paper fingerprint cards, mail them to Gemalto Talus in the Pasadena, California area, and wait the 6 to 8 weeks for the results. Maybe longer. Marina, did you want to add anything to that?
Nope, you covered everything. It's definitely better to go ahead and go to one of the print sites because I know with the COVID restrictions and everything, that the mail actually sits in quarantine before they actually fingerprint it, before they actually process the fingerprints. So sometimes that can add additional time in also. So if they are able to come to the print site location, that's definitely more beneficial.
Thank you.
Thank you. Next question, someone asked, would it be advisable to get all employees reprinted effective 9/1/2021?
that would be a facility agency decision. It's not required, but that would be a facility decision. If you wanted to get that additional layer of protection and make sure all of them are covered under wrap back, that would certainly be optimal.
Okay, thank you. The next question is further explain the automated consent form, the scope of the registration process, and does a provider know when the applicant has completed their portion so we can go forward?
Okay, Brad, I'm going to turn this question over to you.
Sorry, Sakina, could you please repeat the question?
Sure. Further explain the automated consent form, the scope of the registration process, and does the provider know when the applicant has completed their portion so that we can move forward?
Yes, absolutely. The way it works is when the profile is created for the applicant and they have an email address, a notification is sent to that email address with some information and a link for them to complete their disclosure survey. You can see if they've started that, if they've not started that, and if they've completed it in the system. There are different tables and pages where you can see those statuses. Once they complete it, then it can move forward. And the moving forward at that point would be the DCH side. I don't know if there'd be any action on your part at that point, but you could see that it's moved forward and things are progressing. Thank you.
Okay, thank you. The next question is what does the fingerprint background check for? For instance, GCIC, county, multi-jurisdictional index, social security trace?
Marina, can you answer that question?
Okay, the question is, what is the background check for, or what does it cover?
I think what does it cover? Like, what does it check? The GCIC, county, multi-jurisdictional?
Yes, so it actually covers all of the state of Georgia, but it also covers all of the other states in the United States. So what happens is your prints come in and we search Georgia and we kind of do a preliminary check. I won't go into how all of it works, but we kind of do a preliminary check. And then from there, we send your fingerprints to the FBI. The FBI will do a check for all the states that they respond for, and any states that respond for themselves, the FBI sends it out to them as well. And then all of that information is compiled and then comes back in one criminal history record check report.
Okay, great, thank you. The next question is, do we know of any fingerprinting sites that are doing mass printing, for instance, coming on site to do prints for staff at one time?
So there are some mobile fingerprinting sites. I'm not sure where you're located, but that is something that we can look into to see if there are any that are located near you, or if we could find one that is willing to travel. If there's a need, we just need to know about it, and we can work with the vendor to see what we can do to get you all some assistance.
Okay, thank you. The next question is, where can I get the information in writing about Ratback to provide to the owner of our personal care home?
Okay, we're going to post this information on our GCheck's website. I'm going to try to provide it in the Q&A section. It will be posted on the website, and we are recording this presentation. So just bear with us for a day or two, and we'll have it posted up on the site within a few days, probably by Monday, I'm thinking.
Okay, thank you. Next question. Has the verbiage in the consent form / Privacy Act changed?
The verbiage is exactly as it was. We basically just kind of automated that process. It is automated now, so the verbiage has not changed. They may have to check on a couple of boxes, but the verbiage has not changed because every state agency that conducts background check, FBI background checks, is required to have their employees attest to this document. So it's a federal and state document that has not been altered.
Now, I will say that not too long ago, the applicant privacy rights that we posted on the GAPS website and on our blog now include a line that references wrapback. So I'm not sure if that's the change that they're referring to, but that was the only change that was made, because we had to make sure that anybody that was going to be enrolled in wrapback was aware that their fingerprints were going to be retained, since that's not something we had done in the past.
Thank you.
Okay, thank you. Another question is, if any applicant is maintaining their current employer and also joining another team or another facility as a new employee, will they be required to do another fingerprint?
It's my understanding that if that new facility wants to retain those fingerprints, the new facility, the additional employer would need to do the background check if they want to have the information retained. If, say, the applicant is retained by facility A, based on my information, I have information that this person's fingerprints are retained. Something comes back, all I have on file is to notify facility A. But if a person is employed also at facility B and they have not completed any type of background check, I would have no way in knowing that this person is working at another facility for me to notify them of an adverse decision.
Okay, thank you. The next question is, if the employer does request for the fingerprint and the employee, I think this is referring to, I think, the applicant initiated consent form. If the employee does not get the email so that they can sign the consent form, is the employer able to continue with the registration process?
No, the employer will not be able to continue with the registration process. Remember, the employee is giving us consent. It's giving consent to this background check, is giving consent that they have read the Privacy Act. So therefore, the employee, I would recommend that the employers notify their employees that, hey, you're going to get this consent form and your email address, check it, because you can't move forward without this employee completing that Privacy Act.
Okay, and the next question is, now that the consent process is automated, will we still need to upload a completed consent form?
No, you will not. Once we deploy the new Privacy Act consent form, you would not need to upload the old consent form, the Privacy Act.
Place here. Okay. And another question pertaining to, I think, the consent form is, how do we obtain access to the electronic acknowledgement of the applicant's non-criminal justice privacy rights and consent that includes the wrapback section?
Well, that electronic form will be generated during the GCheck's registration. And once the applicant has completed it, then the notification will be inside of the GCheck system. Brad, will that be a printable form, or they needed to print it after the applicant has signed it?
It could potentially be printed by the applicant, but because it's disclosing potential, it's set up in a way in other states where they use it to disclose potential criminal history, it's not visible by the provider. You would just know that it has been completed. We can publish the screenshots of what the content is that they're consenting to, but you, as the facility, would not be able to see the contents of the information.
Okay, thank you.
And I'd like to go ahead and just wrap the webinar up at this time. We have come to the conclusion. I want to thank everyone for their attendance. Please feel free to check back on our website over the next couple of days at dch.georgia.gov and navigate to the Georgia Criminal Background Check System webpage in our website. And we will have a link to this recording and some frequently asked questions that should be posted in the next couple of days. Again, I wish everyone safety and thank you for attending.
Thank you. Thank you so much for attending, everybody.